Good afternoon. Thank you for joining. My name is Alexandra Reyes, VP of Operations for Regent Surgical Health. Today, I will be speaking about accelerating organic growth in your ASC. So here are the agenda topics. We're going to talk about current state, organic growth strategy, the growth team, how to get started, success stories, and next steps. With regards to organic growth strategy, we want to focus on the following key objectives. So standardization of driven initiatives, identifying criteria needed for organic growth, coordination of center initiatives and rollout, and track and measure results for initiatives implemented. 2021 same-store growth performance. So the 2021 goals were case volume growth of 3% to budget, as well as EBITDA growth, 10% to budget. Now, when we looked at the overall centers, there were 7 centers that did not hit 3% same-store growth goals, and there were 8 centers that did not hit 10% EBITDA goals. This is just, I wanted to share a sample data set, including 5 facilities that we looked at. So partners had 2.5 times the number of cases than their current utilizers in the selection of centers, which is exactly what you want to see. You want to see your partners having at least 2.5 times the number of cases than your utilizers. So adding new physician partners and maximizing existing partners is key to a solid organic growth plan. Organic growth strategy. So growth can be achieved by using the following methodology and principles at your center. Organic growth strategy. So we look at it in two parts. So we look at internal growth as well as external growth. With internal growth, you're increasing cases from your existing physicians and physician groups. External growth, you're adding new physicians as well as new cases. So same-store growth is what's going to drive your performance to goals. Case volume growth, 3% to budget, EBITDA growth, 10% to budget. This is your growth team. So you have your administrator, who is the business expert. 60% of the time is focused on growth, 40% internal, 20% external. Relationship management with physicians, schedulers, and practice managers, identifying internal and external prospects, and growth activities would include optimizing staffing and scheduling, as well as new equipment orders, and speaking with physicians. Your VP of operations is the market expert. 60% of their time is focused on growth, 40% on external growth, and 20% on internal growth. They help to facilitate growth discussions, identifying external prospects. Some of the growth activities would include completing an ASC profile and reviewing that with the administrator, as well as your physician champion, having monthly calls with the administrator and physician champion to discuss pipeline, next steps and responsibilities, and also presenting to the board, discussing the importance of organic growth and referral base, and assisting in conversations with physicians. Then you have a director of strategic growth or physician liaison. This is your development expert. So 100% of their time is focused on growth, helping to finalize internal physician discussions, consulting on recruitment, having final discussions on new recruits or new partners. Some of the growth activities include reviewing the ASC profile, identifying opportunities for growth, making sure that they're part of those monthly growth calls with the organic growth team, having in-market visits with physician champion, as well as the VP of ops to recruit new physicians. Then you have a physician champion or physician advisory board. So it's important to identify a physician champion at your center. And this So this physician champion will serve as your growth ambassador to the board and to your physician partners. They will refer new physicians to the center, and they'll participate in your monthly growth meetings, as well as communicate to the board based on any progress that has been made with growth. So how do we get started? So first, we need to identify your key stakeholders. So those are your practice administrators, schedulers, and of course, physicians. So you want to meet with your practice administrators and schedulers. You want to have weekly touch points, maybe schedule luncheons, schedule tours of the facility. That's also really important to keep people engaged and to give them an idea of what the center looks like and introduce them to your team. Aligning your recruitment efforts and expected physician volumes, identify barriers to attracting additional volume. So the goal is to become the easy button for scheduling and to gain intel on prospective physicians. You also want to identify physician pain points, identify physicians who want to grow volume, build relationships and trust, become the best place to practice, create a physician advisory board. Your goal is to grow utilizer and partner volume, identify internal and external prospects. Work with your VP of operations, if you have one. Identify 10 new prospects, external and internal, per month. Hold monthly whiteboard meetings, which are your growth meetings, to review pipeline of physicians. The goal there would be to move physicians from prospects to utilizers to partners. Gain physician partners. Analyze utilizer versus partner case volumes. Explain the benefits of partnership to your utilizer physicians. Achieve and sustain same-store growth through increasing partners and utilizers. These are just some examples of success stories that I wanted to share. So we have ASC number one. Their growth, most of their growth was attributed to capitalizing on their physician champion and executing on internal growth. So their bottom line grew significantly. Case volume, they had a 3% over budget growth. Their net revenue, 20% over budget growth. Service lines, so they actually added 2 new service lines, gynecology and otology. They started performing high revenue cases with ENT. This is specifically an Inspire procedure for sleep apnea. And investment growth. So they had 1 new investor. They had 3 potential investors to close their deals in Q1 of 2022. And they had an engaged partner and board members to assist with the internal growth. ASC2 results. So most of their growth was attributed to the one-to-one administrator and physician relationships. So their bottom line growth, they had an increase in 927 cases with growth, with volume. Collections were up 2.1 million. Net revenue was up 2.8 million, and their EBITDA was up 1.5 million. With regards to physician growth, they had 8 new surgeons credentialed, 10 surgeons in the pipeline for Q2 of 2022, and 3 new physician investors. So what are next steps? So one of the things would be making sure you implement those growth meetings with your Director of Strategic Growth or Physician Liaison and VP of Operations, as well as your Physician Champion. You want to do a SWOT analysis, and I'll show you an example of one that I have at the end of the presentation, but that's always important. Implement monthly organic growth meetings, again, with your admin as well as your Physician Champion. Utilize data to support your growth discussions. Complete regular assessments of growth needs by market and facility. Collaborate and share best practices. And measure your organic growth by comparing year-over-year revenue growth rates, profit margins, and operating efficiencies. Another thing that we did was, so the administrators would have consistent dialogue with their existing physicians to discuss potential for same-store growth opportunities, to assess any growth in their practices that will convert into additional surgeries, determine block time needs for future growth, redirecting available block time to surgeons with high acuity cases, like total joints or spine, helping to facilitate increase their volume, and evaluating opportunity for adding a new service line or new procedures. I wanted to include, this is just one of the forms that you can use for your monthly growth meetings. Keeps you on track. This way you can track and trend what's happening on a monthly basis. So you have your budgeted case month to date, what your budgeted cases are year to date, current projections month to date, current projections year to date, and then you have the list of your utilizers and investors, names, issues, goals, as well as action items and the progress timeline. And then also you want to list your top external opportunities, as well as potential service with line expansion. And then any takeaway action items to follow up on. And this is just a SWOT template you can use. So you want to include key physician dynamics, again, any service line information, and also staffing or supply challenges. Thank you for giving me the opportunity to talk about organic growth in your centers. If you have any questions, please feel free to use my email, and I'll be more than happy to share any other information that you would like. Thank you so much, and have a great day.